Hi, I'm Patricia Greenberg, and today my guest is Dr. Stephen Lev. He's a neuroradiologist practicing in Long Island, New York. And I am so excited to have him here because one of my interests is what goes on inside the body that we can't see. Dr. Stephen Lev spends his day looking inside the human body because he is a radiologist. Welcome, Dr. Lev.
Hi, welcome, and it's my great pleasure to be here with you today.
Now, I asked you to come onto the show because, I'm so interested in how your specialty plays a role in diagnosing diseases, of course, and radiology as a window to the way or how the body functions and how well we're faring in this process as our life goes along. But I want to start out and tell us about your background and how you became a neuroradiologist.
All right. Well, I went to Princeton University undergrad, then I went to Mount Sinai Medical School. And at the time, as a fourth-year medical student, I actually at the time thought I would go into anesthesiology because I had a background in chemistry and then kind of made sense to me. And radiology kind of had a reputation, at least from a medical student perspective, as being fairly easy. You don't really deal directly with patients, and you just kind of rotate through a reading room and watch other people look at images.
Okay.
And I really didn't care about radiology at that time, but I did this rotation, and I found that when they had the images up on the boards, this is before the days of computers, it was like the hard copy images, that I would just open my mouth up and say, oh, what's that dot over there? What's that shadow or something over there? And it's like every time I opened up my mouth, people were like impressed, like, holy cow, like I didn't even see that.
Mm-hmm.
And they said that I had a natural ability, a visual ability, which I know I have because I've been an artist since I can remember, since I was 5 years old. Now I'm also a photographer. So I feel like it all ties together, the art, the photography, it's all like this visual ability. And I think some people have it and some don't, and I have it. So
It's
that's
funny
how I
you
got
say
it.
that was my next question because you're a very talented artist. I've seen your work and I enjoy your take on the art and science of evaluating humans. I love if I can steer people to your page, your Facebook page especially, how you've taken some radiology images and turned it into art. So, how does your work inform your art and vice versa?
Well, I'm a neuroradiologist because I like the brain.
Okay.
And I mention that because about 5 years ago, I presented a paper exhibit at one of the national scientific meetings on a day at the Metropolitan Museum of Art through the eyes of a neuroradiologist. So that kind of addresses your question.
Okay.
And it just came upon me one day when I wrote that paper that the same way that we go to a museum and look at paintings and artwork, and if you look at my office, like even my sofa has artwork on it,
Mm-hmm.
and I have artwork all over the walls, but the same way we look at artwork is the same way that we look at images of the human body. It's the same thought process. Basically, there's a story behind it, and the story helps the way we interpret it. And the analogies don't stop there. When I look at artwork, I tell people, go from the general to the specific. Is this a landscape painting? Is this a portrait? What's going on? And it's the same thing when I look at a radiological image, whether it's a CT. I go from the general to the specific. And I see a lot of people are very quick to nitpick little dots.
Mm-hmm.
And, but they miss the whole overview. And there's a lot of different analogies I came up with that you have to look at. For example, in the brain, it's unlike the abdomen and the chest in that it's very symmetrical. So when I look at a CAT scan of the brain, I look for symmetry.
Okay.
And if there's an absence of symmetry, it throws me off. And the same way when I look at a painting of the Renaissance masters, it's all about symmetry. But if you look at more modern art or the Impressionists, then they lose that. And there's a lot of parallels going on between art and radiology.
That's so interesting. So is there a natural asymmetry, or in the brain, if it's not symmetrical, it's an indicator that something's going on?
Well, there are cases of pathologies where you could have a symmetrical brain that's abnormal. But in most cases, if you're doing like a stroke or a tumor or bleed, it's going to create like a mass effect on the brain and cause like an asymmetry. So
I
that's one of
see.
the things that I would look for.
Now, can we go back to nuts and bolts? Because you and I, like you mentioned earlier, we're old enough to remember before computers took over and all this state-of-the-art machinery was available to us. So how do X-ray, and it's a kind of a big question, but how do X-rays and scans work? And can you tell us how to differentiate the myriad of tests now available? X-rays,
Yeah,
MRI, CAT scans, PET scans, contrast,
yeah.
ultrasound,
It's a tough question,
Uh-huh.
and to answer it, ideally, I would probably defer to our physicist.
Mhm.
However, for the average person, I think my explanation would be fine.
Okay.
Um, and if you do like a chest X-ray, you stand in front of a machine. An X-ray was initially discovered by William Röntgen at the turn of the century. That's why they call it Röntgenology. It's named
Mm.
after William Röntgen.
Mhm.
And back in those days, like there was no safety control and
Right.
the X-rays were too much. But basically, what an X-ray is, you have like a spinning disc and you have like a cathode tube, and it sends off. You bombard the spinning disc with like electrons, and then the X-rays get shot off. X-rays are invisible, and they penetrate the human body. And the way that X-rays work is they penetrate the soft tissue structures a lot more easily than the more dense structures like bone.
Okay.
And so if I stand in front of a film and you're doing an X-ray of my chest, the X-rays penetrate my body. They hit that film that's behind me. Where they hit the film and develop that film, the film turns black. So that's why the lungs are black.
Oh,
When they hit the
interesting.
bone,
Okay.
the X-rays stop the bone. The bone stops the X-rays.
Got it.
So that stays white. It doesn't get developed. So
Interesting.
that's how X-rays basically work. Now, what a CAT scan machine is, it's shaped like a donut. And the human body is on a table, and you slowly go inside the donut from either the head or the feet. And a CAT scan basically is just like a 360-degree fancy X-ray.
Okay.
And if you take that donut and you imagine all these simultaneous X-ray tubes around the circle going off simultaneously, going through your body all at once. All right. So now instead of one X-ray coming in from one direction, you have another X-ray coming in from another direction all the way around. And each of those beams is going to have a different course through your body and be stopped by bones or soft tissue or air. So how do you put all that together?
Right.
Well, in 1972, a gentleman named Hounsfield basically invented the CAT scan machine. And he took all this information. When we talk about bone or soft tissue stopping an X-ray, that beam of energy gets attenuated. And he used a mathematical equation to take all this attenuation information, and anywhere in that slice, based on the mathematical equation, he could then assign a number.
Wow.
And that number is small if there's no attenuation, or very high if there's a lot of attenuation as a composite. Then the genius of converting that to an image is each number was assigned a grayscale. So 0 would be black and 1,000, say, would be white. So now you actually, instead of just having one X-ray beam and here's your X-ray, now you're basically able to create slices through the human body. And now you could see the heart, the liver, in a basically, like, imagine the brain as an orange.
Mm-hmm.
And now imagine slicing that orange into sections. That's what you're doing here. You're slicing the brain into sections, and you're assigning it a scale from white to black, and that's creating an image, like a black and white TV image.
That's
And now you're
amazing.
seeing
Now,
inside the body. Now,
so
because, yeah,
go ahead. I'm sorry. Go ahead, finish.
because you're doing all these simultaneous X-rays, this sounds like a lot more than an X-ray.
Right.
And so one thing that we have to consider is that the amount of radiation that you're going to receive is going to be a lot more. So whereas I may have no problem myself going for, like, oh, I'll go get a chest X-ray, I probably would, really think twice before routinely going for a CAT scan, because I know it's going to be a lot more radiation exposure to me.
That was exactly my question to you. So we go in, I mean, we could stay here all day talking about head to toe, what's being scanned and what's necessary. So I want to talk about this for a second. I hadn't planned on asking you this, but now that we're talking about it, the question's kind of twofold. How do you go into the ER with an acute situation, a broken bone, an indescribable pain, a severe headache? How does the frontline healthcare provider know which test to provide at that moment? So if I go in and something's bothering me and the doctor says I'm going to do a sonogram, why don't you just go for broke and do the golden standard with every test?
Okay. Well, before I answer that question, I realized when I gave you my CAT scan answer, I said I would talk in pretty practical terms, not at a physics level, but I
Yeah.
gave you that was a pretty hardcore
Yes, it
in-depth
was.
explanation.
Yes, it was. It was an
And I'm
amazing
sorry,
description. Uh-huh.
I'm
That's okay.
sorry if I lost
That's
some
okay.
people.
No, it's perfect.
It might have been enough if I just said that it's a fancier X-ray, but I
Okay.
went into detail.
Okay.
So I just want to briefly mention that other radiology modalities at our disposal include ultrasound, which is sound waves penetrating the body. And as you can imagine, that's really not going to have any harmful effects at all.
Uh-huh.
And then another modality that we have is MRI, which means magnetic resonance imaging. And the way that works is it looks exactly like a CAT scan from the outside. You go into a donut,
Uh-huh.
but instead of working with X-rays and radiation, you're dealing with magnetic fields that are flipped on and off. And I'm not going to go into the more physics
Yeah,
of
that's
that. That's
okay.
beyond
That's okay.
that's
Yeah.
beyond the scope of this. And so you can imagine if we're just dealing with magnetic fields, unless if you have metal in your body, it's probably not going to be harmful.
Okay.
So now to get to your question, how does the person in the emergency room know what to get for you? And the governing board of the radiology, it's called the American College of Radiology. And through the years, they have been developing a set of what they call clinical appropriateness criteria. It's kind of like a guide for clinicians.
Okay.
And based on the condition that your clinician is suspecting, they will either go with an ultrasound or a CAT scan or an MR. And each test has its own advantages and disadvantages for what we're trying to find out. And a lot of it really comes down to the preference of the radiologist. But just generally speaking, I will tell you that because X-rays are stopped by bone, and that the bone is white, and I'll also tell you that even blood is a little bit dense on a CAT scan, because blood has the hemoglobin has iron in it. Okay. Iron stops the X-rays too, not as much as bone.
Interesting.
But what I want to tell you is the CAT scan is really great for anything where you want to see bones, like you said, fractures, anything like that, any type of trauma situation, because it's great for seeing if there's blood.
Got it.
So that would be really good. MR is better if we're dealing with like subtleties of soft tissue, and we want to see, depending on the sequence of the MR that we use, it gives us specific information about the soft tissues. But in a trauma situation, I think the CT is the way to go in most
Okay.
of the time. Then the question is, why not ultrasound? Because I just told you CT has a lot of radiation. Ultrasound, I think, is very operator dependent. So, and it's also not going to provide us as beautiful an image as a CAT scan. CAT scan is going to show us down to the nearest millimeter, the anatomy of the human body. And if you were to look at an ultrasound image, it's not going to have that level of clarity and sharpness and as much information as provided. CAT scan will give you a lot more information. And now I'm about to go off on another tangent, is you got to be careful, I think, as the ordering clinician. I think in the medical community, because CAT scan provides so much information, that there is a tendency of some clinicians to just over-order CAT scans.
Okay.
And they do head-to-toe CAT scan. And the problem with that is CAT scans are so sensitive to picking up fine detail that I can almost guarantee that people our age, you're going to find something.
Right. Absolutely.
You're going to see a dot in the
Absolutely.
lung. And then what? What are you going to do with this information? You're going to tell me, oh, you got a dot in the lung, you better go for a follow-up. So sometimes having more information is not good. You really want to address the clinical question.
It's so interesting you're saying that, Steve, because we talk so much about in this show about aging and aging well and what can we do? Well, everything about what you do in your life is an accumulation from the day you were born to where we are today, right? And now one of the big things being advertised, and I think they might even be preying upon people in the magazines geared towards older people, is the full body scans to see if you have anything going on. That is a big
I do not
advertised
recommend.
everywhere. Tell me about that. What is that?
Yeah,
Is
yeah,
that a
no,
CAT
I
scan?
don't. For the reason I said, I am not an advocate of this.
Right.
I think that, like I just said, once you're a certain age, you do a full body scan and it will pick up things. And a lot of the things are what I call no-touch lesions. In other words, they're incidental findings that are better off just being left alone. But now you're going to get a doctor and he's going to say, oh, we picked up a dot. We picked up some little thing here, a
Right.
nodule or
Right.
something. And he's going to say, okay, we better follow this. So now you're being subjected to more radiation. And that would be the lesser evil. There might be other people who might say, oh, you have this thing here, we're not sure what it is, let's biopsy it.
Right.
And now you're subjecting yourself to unnecessary tests.
Right.
So
And you're
I
having
really
surgeries.
believe that if you need the study for the appropriate reasons, and then by all means. But just to go for a CAT scan as this overall well-being health thing, I don't agree with that. What I do want to say, though, is that I think once you reach a certain age, and there are specific criteria as you enter your 40s and 50s and 60s and beyond, for what I call, there are certain screening tests.
Right.
For example, I think for men, once you reach a certain age, they recommend go for colonoscopy.
Right.
Now that's potentially a painful procedure, and sigmoidoscopy. Now you could do a CT colonoscopy. And that's one option. Obviously, for women, mammograms. Now the recommendation, they decrease the age to 40. By all means, women should get that. Depending on the history and the family history and the recommendations, lung cancer screening.
Sure.
So this is the type of stuff I think or prostate screening is high yield.
Right.
But just to go on a wild goose chase to anything, I think that's bad medicine.
My guest is Dr. Stephen Lev, and we're talking about radiology, such a fascinating topic. As we age, do you see the same signs of aging inside as we do outside? Like, do our organs wrinkle and atrophy the same way the skin on your face or distribution of fat and muscle. Do you see changes on the inside?
Yes. Um, there's certain changes that I see that I would expect at certain ages.
Okay.
As a neuroradiologist, I could look at somebody's brain and I could probably guess within 10, 15 years how old they are. I
Okay.
say, oh, that's an old looking brain because I'll see atrophy. And in my radiology report, I'll see people don't like to hear the word atrophy.
Right.
So I say involutional change consistent with patient's age. They
Okay.
don't know what that
Okay.
even means. They
Okay.
feel good.
Okay. Okay.
You know, one time I used the word atrophy and the patient was very upset. What do you mean I have atrophy? It's like, it's normal aging. However, if I were to see those same changes, say in a 20-year-old, well, now you're talking very abnormal. Then it could be somebody with HIV or with an eating disorder. You see those type of atrophy changes. Or there's a whole bunch of congenital dementias that you could get early on. Now, these same changes with the brain, we could see elsewhere in the body. You see changes that are associated with normal aging, where
Mhm.
some of the organs maybe shrink a little bit,
Okay.
but then other changes would be more pathological. And what I was really kind of fascinated, like this is a very hot topic right now in radiology, and it's cutting edge and it's evolving. And I just read an article in this month's Journal of Radiology that said they're doing these CAT scan machines, again, that see the inside of the human body. And the CAT scan machines could tell the different densities of the organs. One of these densities,
Really? Wow.
well,
Okay.
that's how it works. Yeah,
Okay.
you see the densities. But one of the densities that it could tell is fat. Fat has a certain appearance. And now they have linked this model of a CAT scan and they link that to a computer. So it could tell you in 5 seconds the percent of body fat that you have, both visceral, external body fat, and visceral or internal body fat. And that really has, and then they linked that to an AI program, artificial intelligence,
Okay.
and correlated that to how patients do in the long run. And they actually found a positive correlation. And so
Really?
now theoretically, you could use a CAT scan machine to determine your percentage of body fat internally and externally, and it'll give you prognostic factors on how you're going to make out in life.
Or,
So
or card,
that's where the future is headed.
that's very interesting. Are cardiologists using this now as a way
Card,
of
yeah,
managing their patients?
well, not that. This what I just described is something that was just published.
Okay.
And
Okay.
but what cardiologists do, and again, they do this in patients who have risk factors for heart disease. You could do a high-speed CAT scan. Basically, it's so fast, this CAT scan machine, that in a single beat of the heart, you get the whole image of the heart. So there's no motion here. And then you could reconstruct it if you give a contrast injection of dye. You could see the blood vessels. And then they could do what's called calcium scoring. So they could see thrombus, plaque formation, calcium. And what's actually interesting, and I thank my colleague, Dr. Amgad Makarios, who's the chair of cardiology, for this tidbit of information. But the person who came up with CT scan calcium scoring is, his name is, I think, Adgerson,
Okay.
something like that.
Mhm.
But he's also a famous author, and he's the one who founded the South Beach diet.
Oh, okay.
So,
Okay. That was
so it's
Atkins,
kind of
I think his name
interesting.
is. Yeah. Hmm.
Yeah, it's kind of interesting
Yeah.
that the person who came up with this very popular diet plan is actually a world famous cardiologist.
Yes, yes, yeah, that is very interesting. And that was like kind of what I was asking earlier about the scans. So in the, like blocked arteries, a polyp in the colon, um, you know, I always say, why take the extra step of a scan when you can go straight to, like you say, a CAT scan of the heart or a colonoscopy? Um, just because you just want to go in and get it.
Well, I'm not able to really tell you which is better
Right,
to
the
go
better
for
choice of tests.
a
I just, yeah, yeah.
colonoscopy in person with a scope versus a CAT scan. And there may be indications for both, depending on
Okay.
your family history.
Mhm.
But that is
I,
an option.
yeah, people are, everybody's an expert now. Everybody, I'm sure, comes into your office and tells you what to do, and everyone thinks they know better than the doctors nowadays because of all the information and misinformation being thrown at this. So I'm just going to really reach out to my audience and the people that are listening today is to please sit back and let the doctor tell you what he's doing. Don't fight it. Don't get into arguments because they do know what they're doing. There's just this terrible people are just think they're over educating themselves online, and they're not there. They don't deal with the day in and day out. So this is, again, why this topic is so of such importance to me. You're a big fan of the magical applications of AI. Now, how is this playing out in medicine? And do you think healthcare workers are being replaced?
That's a good question. And, every year I go to the RSNA meeting. It's an industry meeting in radiology across the board. 100,000 people. Uh, this is, I guess, pre-COVID numbers,
Yes,
usually go to
yes,
this
yeah.
meeting.
Mm-hmm.
And when I used to go there 5 years ago, maybe I would see 5 vendors for AI total. Now they have an entire conference room of AI vendors, hundreds of them, with all different applications. And this is the hottest topic in
Mm-hmm.
medicine right now. It's the
Mm-hmm.
hottest topic in radiology right now. And AI has many applications. In terms of radiology, we talk about CAD, computer assisted detection.
Okay.
And you said our radiologists, our doctors could be replaced. I don't see it that way. I see
Mm-hmm.
it as an assist, as a help. I think if you have a mammogram, and we use this at our hospital, if you have a computer assisted detection AI program that could help you to detect a lesion that you otherwise might miss, why not use it?
Right,
And it
absolutely.
could, right. And from even a neuroradiology point of view, AI programs are detecting intracranial hemorrhages, probably on par, if not better sensitivity than doctors can, than I can. Um, is this going to replace my job? No, because it still can't do a lot of things. Um, can't come up with, but it's getting there. um, what it could do is it could help the doctor to kind of triage the urgency
Mm-hmm.
of your case. If you come into the ER and I have a work list, and the AI could, in 1 nanosecond, look at that work list and pick out for me the cases that really need to come to my attention first. This could really help save your life. So that's
Absolutely.
one. Yeah, so this is
Right.
one good way it's being used. And I know that a lot of the top medical centers in the world, I know Mayo Clinic in Rochester, Minnesota, is currently looking, I believe, for an AI specialist in ChatGPT. this is this is really going to revolutionize the industry. And again, I don't see it as replacing people, but as helping people do their jobs more efficiently.
Right. That's a very well said and a very good way to put it. Dr. Stephen Lev, you're also a runner, a golfer, a triathlete, and an adventurous foodie, which, helps making life happier and healthier and fun, certainly, as we get older. What should we be doing to be proactive in our own healthcare education? When we need medication or surgery is indicated, physical therapy, whatever it may be, what's the best place to go to get the help you need and get the proper information?
Could you? I'm sorry. Could you
Yeah, that's okay.
rephrase
Yeah,
that?
yeah. I'm
Yeah.
just what I was asking is, what should we be doing to be proactive in our own healthcare education?
Um, I know this ties into a little bit about my feelings about like non-traditional medicines and homeopathic stuff, and um, I
Yeah,
think,
that's what I was going to ask you. What is your take on
yeah,
alternative medicine? Mm-hmm.
yeah. No, I think you have to realize that, and not everybody in medicine in hospitals is going to like this answer. But as far as I'm concerned, talking about me, I realize that medicine, pharmaceuticals, it's a big industry.
Mm-hmm.
All right. And how does that industry stay afloat? We're talking multi-billion-dollar industry. We talk about people being sick. We talk about doctors prescribing drugs to make you feel better. All right. And that's how the whole world works. That's how the industry works. That's why healthcare is so big. So what could you do is, if you think about what I just said, if you weren't sick and if you didn't, then the industry, then a lot of people would be out of jobs. That whole pharmaceutical business would be over. So I think from the patient's point of view, I'm really a big advocate, and this ties into my running and marathons and triathlons and trying to eat well. It's preventative medicine. You really want to take care of yourself, and that's really up to you. And I notice, I said I went to Mount Sinai Medical School. One thing that's not on the agenda in medical school is what I just said, is preventative medicine. And if it is, it's downplayed. And so this is really, I think, up to each individual to really try to take care of themselves, to exercise, to eat healthy, to get enough sleep, to not drink too much, not smoke. I can't emphasize that enough.
Right.
Once you go and start and something goes wrong, what are your options at that point? Now you're sick.
You can't
Now
play catch up. Right. Mm-hmm.
Right. Now you have to take pills. Now you have to get the joints replaced. Now, the damage is done already, and they're just trying to patch together what they can. So I think the best thing is to take good care of yourself as long as you can and not get into that situation.
Yep. You're my kindred spirit. That's exactly what I've been thinking. Dr. Stephen Lev, I want to thank you so much for being here today. It's been very informative and very enlightening, and I love your take on it. And I wish you the best going forward with all that you're doing. And lastly, what do you like about getting older?
When I saw that question of yours, my first thought was nothing.
I've heard that
But
before
that
too.
seems
Yeah.
that seems a little too easy. The other thing that just comes to mind right now is I think as you get older, you have a lot of accumulated wisdom.
Yeah.
Of all the decades and years that you've spent, and I think you could just, in a way, you appreciate things more as you get older. I think so. Almost a little philosophical here. As you get older, I think you have more a sense of perspective that we do not live forever.
Right.
I think when you're young in your 20s, you think, I'm going to live forever. You don't think about the future. It's like, and the time goes by quickly. And I think as you get older, you think, well, I am mortal. And you try to have greater appreciation for like every day and just enjoy and make the best out of every moment.
Absolutely.
And I think that's something I've acquired as I've gotten older.
Thank you for that. And again, I wish you a very happy, healthy, long life. Thank you so much for joining us, Dr. Lev. I hope you'll come back at some point because there's so much more to talk about.
Okay. Thank you.